Hi, I'm Lauren Ohayon, and today we are talking about prolapse, specifically to those lifting weights. So we'll start by defining what is a prolapse. A prolapse is when the organs inside your pelvis, so it can be your uterus, have shifted positions and is now not where it used to be. So this can be that the uterus has shifted more towards the front. It can also be where the bladder has shifted positions. It can also be where the uterus has shifted positions more towards the rear. So there are different types of prolapse of these organs, and they can go forward or backward, or sometimes people have a combination of prolapses. What people will feel when they have a prolapse differs person to person, but more or less, there will be a feeling of heaviness or dragging in the pelvic floor area. It might feel like there's always a tampon in there, something kind of sticking in there. When you do wear a tampon, sometimes you might push the tampon out a lot or have difficulty keeping a tampon or a menstrual cup in place. It can also produce the feeling and sensation of lots of bubbles inside of the vaginal cavity. It can, depending on if it's a rectocele, so a prolapse more towards the rear, it can impact bowel movement. And there are various grades of these shifting of organs, depending on how low the prolapse goes towards your vaginal entry or in the rectum, then it is, there are different grades. The most severe being where there is a protrusion of organs from your vaginal entry. Prolapse can occur in all different types of people, including in males. It is not something that only happens to people who've had a baby, although that seems to be the prevailing conversation. I have clients who are 18 with a prolapse. I have clients who've never had children, male and female, and I have multiple athletes. That's kind of what we're talking about today. I have multiple athletes who have a prolapse, and I have many athletes with a prolapse who end up getting back to the sport they love. So that's great news. Why do athletes have more of a disposition to prolapse? They don't. So it's just, I think what happens is people are shocked when they are so athletic and fit and strong and all of those qualities. They are shocked to have this injury occur because it seems to almost be some sort of a logical fallacy of how that can happen. So I just want to explain a little bit more about how that might happen, and then specific to weightlifting. As we said, a prolapse is a shifting of organs from their normal position, their usual position, more downward into the pelvic cavity. And what is described as often as the organs are falling out, and people will often describe it at that way themselves. It's not actually a falling out of organs. Nothing really falls out of the body. Like if you were to do a handstand, your eyeballs wouldn't fall from your body, from your head, right? Nothing falls from the body because things are strongly connected by ligaments, tissues, tendons, and muscles. However, it might feel that way, but things have just really shifted position. So the question really is, what might be pushing the organs out of their position? Like what might cause that? Now, nobody really knows what causes a prolapse. There's no definitive answer on that. There's just a lot of speculation based on laws of physics and biomechanics and logic. One of the things I do see, I will say back to the childbirth thing, is I do see, and we see that there's a lot of prolapse with the population of anybody who has had forceps or vacuum delivery. That can kind of create an injury, so to speak, to the tissue, the tendons, the ligaments that keep the organs in their place. That can create some of that, as well as people with connective tissue disorders like Ehlers-Danlos, anywhere on that spectrum, that population seems to be a little bit more prone to prolapse from what I've seen. This is very anecdotal and clinical, those numbers of what I see, but I do see a lot of prolapse with those populations, including with athletes. So having an understanding of kind of what's the mechanics of all of this can be really helpful. So while we don't really know what causes a prolapse, we do have a strong understanding of what can make it a lot worse and what may have been the issue to begin with. The pelvic floor is part of a system which includes the pelvic floor at the bottom, but then the core in the middle, the rib cage and breathing and diaphragm at the top, and then the back, the spine in the back. So it's this canister, so to speak. So I want you to imagine it like a canister. It's not just happening here, even though that might be your lived sensation. Your pelvic floor is part of this whole canister. And this entire canister, like this ball, is managing pressure all of the time. So maybe if I'm not squeezing on it, it has an even amount of pressure throughout the ball. But the minute I start squeezing on it, pressure moves here, pressure moves there. If I were to squeeze on this ball for a very long time, and this ball maybe wasn't made of the material that it's made of, that ball might start to give. So imagine now it's not a ball, but it's a plastic bag of apples or sweet potatoes, right? Or a combination. And I put them in the bag and I'm squeezing really hard and I'm pushing down really hard, the bag will start to kind of give and stretch and possibly then open and the apples end up on the floor. Now, I'm not saying your pelvic organs are apples and that your pelvic floor is a plastic bag, but that idea of pressure, pushing down on a body part, weakening it, and changing the resting tension and the integrity within that structure. It's exactly what happens in this entire core canister. For a moment, don't worry about where my ball is, but you don't have to have a ball and you don't have to do that. I'm just putting it away. For a moment, I want you to wrap your hands around your rib cage and I want you for a moment to exhale and squeeze your ribs really tight, like you're pulling them in. Pull as you exhale. Squeeze, squeeze, squeeze. And you can feel your abdominals start to push forward. But if you have a felt sense in your pelvic floor, if you have that level of awareness, you can start to feel your pelvic organs pressing down on your perineum area. So that pressing down on the perineum area, that pressure on the pelvic floor is in fact what can start to push the organs down, because the pelvic floor ultimately is not like a plastic bag, but it's also not like this ball. And it's not designed to withstand all of that pressure all of the time. It's designed to modulate pressure. So there's this kind of ability, like a valve, to modulate and regulate pressure. But when the pressure is so much and it's pushing down, the body is really intelligent. It's like, okay, you want this out of the way. Let's just let those organs move out of the way, a weakening of the structures, so to speak. This cascade happens, but that cascade that ends up with the organs no longer being in their usual position, that cascade actually begins with is compounded by all of this pressure happening in the container, in the canister. So we really have to consider the question that I pose to a lot of my clients with a prolapse is, where is that pressure coming from? Where is the valve turned on a little too hard? And the question really comes down to, what are our patterns that are leading to that? Now, athletes specifically have a pattern that is pretty uniform to a lot of athletes. And that pattern is how they might be engaging their core when they do a movement. So take your hands onto your belly for a second and go ahead and once again do that exhale and push your stomach outward into your hands. Push out, push out, push out. But then I want you to do it one more time, but this time I want you to try to tighten your abdominal muscles as you push out. So imagine that someone's got you're in a loving situation, but someone goes to kick you in the stomach. You're going to harden it and push it out. I want you to try to find that, like a tightening, and then a pushing out. And again, if you've got a felt sense in your pelvic floor, you might feel how your pelvic floor organs suddenly push downward even more into the pelvic area. Don't worry, you can actually make your prolapse worse by doing it once or twice, but if you're doing it all the time, that's a problem. And a lot of the athletes and CrossFitters that I work with, like various athletes, not just CrossFitters, but athletes and CrossFitters and weightlifters and all sorts of types of fitness modalities that I work with, they are lifting heavy weights. And when I test their strategy against load, they are hardening, great, and pushing out, not great. So they are not hardening and corseting in. They're not, which I don't want you to start like sucking your belly in every time that's very reductive and simplistic, and that's not what you should be doing instead. Okay, so I'm just telling you what you might be doing, which might be that and I have a very low load here, but anytime you are moving your weight around, whether it's forward or upward or here, if in response to having this weight, your body tightens, hardens, and presses outward, you are, as you could probably feel, pushing your organs downward even more. So one of the things we have to, and is it possible then to lift heavy weights without that? It is. It is absolutely possible to learn how to manage the load of a weight within the like pressure management of your core and pelvic floor to meet the weight with a system of support. That is completely possible. But again, what a lot of people who are lifting heavy weights, they're not only holding a heavy weight and doing, like, they're not just holding it, they're now doing repetitive movements very quickly. They're probably not thinking that hard about their breath. Their body's just like powering through. Things like that, which is fine, right? This is like the body's strategy, but the system was never prepared, so to speak, on how to really manage heavier loads. And that's a problem. A lot of people I work with just never learned those essential core and pelvic floor foundations before they got into lifting. And because they could lift a heavy load, there was no thought, which is normal, I'm not judging that, but there was no thought that maybe the way they were lifting the load could be problematic to their pelvic floor. Because they're able to lift the load. The arms are strong enough, the glutes are strong enough, the legs are strong enough. The problem is the pressure system is not well balanced. It's not well utilized. It's excessive amounts of tension and tightness every time there is load transference, which when I do also assess those with prolapse who happen to be athletes as well, they're utilizing a lot of the same techniques even in their daily life. They are actually walking around with core muscles that are not well balanced. Their obliques might be excessively active, more so than some of the other abdominal muscles. So there's this system, this built-in system that's designed to also modulate and regulate pressure is imbalanced because the muscle tone is imbalanced there. So we really, with those of you who are lifting weights and you have a prolapse, the good news is you can absolutely go back to what you love. The other news is you absolutely need to train your core and pelvic floor to handle the loads progressively. And many of my clients don't want to hear that they have to, which I totally understand, that they have to scale it back, that they have to go back a little bit, lower loads, even body weight loads, to learn how to not bear down, how to not squeeze and push the core outward with every breath they take. That is a learning curve that you just have to go back and learn so that you can then translate that into your movements. If you do have a prolapse, and you are interested in lifting weights, there's good news and bad news. The news is that you will probably, as I said just now, need to regress and scale and learn some really important core and pelvic floor foundations. It is also really important that in learning the core and pelvic floor foundations, that you are also taking care of, you are doing a good amount of mobility training for the pelvic floor. And I don't mean things like Kegels and squeezes of your pelvic floor. In fact, for people who have a prolapse, the common treatment of Kegels is not that helpful. There is this mismanagement of pressure. If this mismanagement of pressure is just that the core muscles are firing in a bearing down way, okay, but 99% of people, that's not the case. The core is firing that way because it hasn't learned different, but also because there is a lack of mobility, there is restricted tissue, the spine is not moving as much. All of these can create that excess pressure. So in addition to the core wall kind of hardening and tensing and pushing outward, as we just said, the other thing that happens is that tight, tense tissues create that pressure imbalance. If my upper body or my spine is tight and rigid, I'm not able to get that modulating. The way to get that modulating of pressure through the system is to ensure that I don't have one area that's super tight and restricted, right? And that's constantly pressuring and getting my core, right? Inviting my core to kind of bust outward and to bulge and to brace outward with that pushing out, bearing down on the pelvic floor. So I just want to make sure that it's really clear that there is a path forward. You can absolutely be lifting weights. You absolutely probably most likely need to regress for a while, learn the foundations. And then in addition to learning the foundations of good breathing techniques and good core engagement strategy, is important to really start paying attention to mobility of the whole canister. So the canister includes the upper body, as we said, the rib cage, as we said, the spine. We've got the hips and the pelvis. All of that needs to be accounted for. So you really want to be balancing your weight lifting with tissue and joint mobility, strengthening and stretching movements like that as well. Thank you so much for paying attention.